Well, hey there. This month at Superior Physical Therapy, we wanted to do something nice for all of our fans out there and anybody who might be struggling with foot pain. We wanted to give you a quick presentation on the 3 most common types of foot pain and maybe give you some guidance on what might be causing your foot pain. So the first topic, or the number 1 most common reason someone has foot pain, is called plantar fasciitis. The number 2 most common reason somebody has foot pain is Achilles tendinitis. And number 3 are bunions. So let's talk about plantar fasciitis real quick. Here's a nice image showing the plantar fascia anatomically, where it attaches and where it is on the bottom of the foot. Plantar fasciitis basically is inflammation of the connective tissue at the bottom of the foot. So this connective tissue right here that connects these bones gets inflamed. But recognize that inflammation is a stress response. So what that really is saying is that the body, that tissue, is getting too much stress. It can't handle the stress that's happening to it. Most commonly, the symptoms are pain with standing, walking, and running, and it's usually worse in the morning. So what causes plantar fasciitis? Well, again, inflammation is a stress response. It is the first phase of healing. So whatever is happening to that tissue is causing the tissue to break down, and the body feels a need to heal that tissue. So the physical stresses are too high. This is usually caused by either improper ankle motion, hip motion, or upper spine motion. Basically, when the foot flattens out or pronates, that causes stress on the plantar fascia. It's important to recognize that when our foot hits the ground when we're walking, it's normal to flatten out. But then the foot goes through a lifting phase where the arch lifts up and it becomes rigid. And the foot is designed to push off of a rigid, bony structure and not a flat, pancake-like structure, which would cause too much stress on the plantar fascia. The second most common cause is Achilles tendinitis. Here's a nice image of the Achilles tendon attaching to the calcaneus, or the heel bone. What is it? Well, again, it's inflammation of the Achilles tendon. The Achilles tendon is having too much stress and it's breaking down the tissue. And most commonly, we have pain in the back of the heel with walking, standing, or running, and it usually is worse after sitting for long periods or in the morning. So again, what causes it? Sorry about that. Again, it's inflammation, so that means that whatever's happening is there's too much stress on the Achilles. The whole body works together. All the units of the body work together to decelerate the stress or the forces that are happening to us. That means the Achilles tendon is doing too much and other parts of the body are not doing enough. The most common causes for Achilles tendinitis are actually found in the ankle, the hips, and again the upper spine. We're going to go into some more detail here. How does the ankle cause Achilles tendinitis? Well, very simply, if the ankle doesn't bend enough or rotate outward enough when we walk, this causes the foot to churn out and it makes the foot flatten out more or pronate more, which can cause lots of stress on the Achilles tendon. The foot likes to push off of a rigid foot, not a flat pancake. So how does the hip cause Achilles tendinitis? Well, if the hip is not strong enough to decelerate the forces that are happening when we're walking or running, the Achilles tendon and the muscles that attach to it are going to have to do too much deceleration of forces. The forces can be upwards of 2 to 3 times your body weight, so we're talking very high force. If the hip is not mobile enough, it can also cause the foot to be, again, like a pancake structure. When we take our step forward, as we extend our hip, if the front of our hip is very tight, it can cause our whole leg to turn out. That's called the medial heel whip, which can cause the foot to flatten out like a pancake and cause lots of stress on that Achilles tendon. And finally, our last topic are dreaded bunions. Here's a great picture of a bunion. You can see how the bone is actually turned to the side and you have a little nodule right here. So what is it? It's a bony deformity of the great toe. Again, bones grow thicker when they have stress. So the stress, the overstress to the inside of that big toe causes that big toe to get pushed to the side and it creates this big nodule. Usually we have pain with walking or moving the big toe. So what causes it? That's a really deep question. We're going to say improper walking mechanics, most commonly the ankle and the hip. You'll see people walking like a duck. The duck walk is usually what's creating the bunion and the stress response. I just wanted to throw this out there for you guys. Thank you for spending time watching this. I hope you're doing well. It's been a while since we've seen you, which is great. I wanted to offer you this month, the month of April, we're going to be doing 10 free assessments on anybody that has foot or ankle pain. So if you or anybody you know has foot or ankle pain, feel free to contact us, 231-944-6541. And thank you so much for listening to my presentation.